How many of you have done dissection before? No? Okay. So would you like to see a dissected eye? Yes? Okay. Do you think that by seeing and by feeling the tissues, you will understand it better? Definitely yes, isn't it? That's my theory at least. So we are trying to, okay, we are here. So this is a goat's eye, okay? We cannot have a human eye dissection, and therefore the closest we can get is a pig's eye or a goat's eye. And today we have a goat's eye for dissection. Can you see this goat's eye? Okay. What do you see here? What is this structure? Cornea. Why do you think it is cornea? Why not this is cornea? Yes, because this is a transparent structure. Is it circular? Is it circular or no? Look at your friend's eye and see if it is circular or not. Circular? But why is this not circular? Because from each animal will have its own characteristics, and therefore this goat has a oval cornea, whereas human corneas are circular. Small change in the diameter is there between horizontal and vertical, which is very small. More or less it is a spherical structure. What do you see this? Can you see some stalk over here? What structure do you think is this? Yes? What is optic nerve? What is optic nerve? Loudly. Can somebody tell me loudly what is optic nerve? It's a motor nerve, sensory nerve, sensory, special sensory or common sensory nerve? It's a special, what special sense does it serve? Vision, isn't it? So the whole retinal fibers are joining together to form the optic nerve, and it leaves the eye at the back side of the eye. So this is the front side of the eye, okay, and this is the back side of the eye. This is called the optic nerve. It has been cut. This optic nerve is the one which connects the eye to the brain. So whatever you see reaches there. Suppose for any reason, because of trauma, there is a cut in the optic nerve. Even if the whole eye is normal, you will not be able to see, because the main connection or relay of the information from the eye to the brain occurs through this. So any condition which has got optic atrophy, the vision will not be there. Even if you have the best cornea, best lens, best retina, if optic nerve is damaged, your vision will be very, very poor. This is one structure which cannot be regenerated. It doesn't regenerate. Any other tissue, suppose there is a corneal injury, cornea will regenerate, but optic nerve will not regenerate. So it's very, very important to conserve it all the time. What is this pinkish structure which is seen here? Yes? Loudly? Muscle. What muscle is this? Extraocular muscle. So if this is the eye, this is the superior surface, this will be the superior rectus muscle, this will be the lateral rectus muscle, this will be the inferior rectus muscle, here it is cut, and this will be the medial rectus muscle. So the 4 recti muscles come from the orbit and get attached to the sclera around the limbus at various distances from it. This is called the Tillox, the spiral of Tillox. So this is the attachment. There are 2 other extraocular muscles which are attached close to the macula, and they are, here there is a lot of fat tissue which is seen. So beneath this will be the, here, beneath this close to the lateral rectus will be the inferior oblique, and above that will be the superior oblique. These are the 2 muscles which are attached behind the equator. Rest of the muscles are attached in front of the equator. So which are these 2 oblique muscles? superior oblique and inferior oblique. So can you just tell me all the 6 extraocular muscles? Perfect. The 4 recti muscles are attached in front of the equator behind the limbus, whereas the obliques are attached behind the equator. So what is this tissue which you are seeing here? It is over the sclera. See? Conjunctiva. So this is all conjunctiva which is covering the sclera. And there are 2 more thin layers over there which are called the Tenon's capsule and the episclera. These structures are also there which are very thin and will not be able to dissect individually. Okay, so this is what we are seeing. Now, can you see something inside the eye? Is there a brown tissue and a black area there? What is that black area? Pupil. And what is that brown area? Iris. What is the color of the iris in normal people? In Indians, it is brown in color. Okay? See, it's brown in color in the right picture. Whereas in the Western countries, even in India, many people have light colored iris. So this is a goat's eye. I also got confused. So it has got a light color over here. Can you see that? And even the pupil is not round. Our pupils are round, whereas this is oval in shape. Okay, now shall I just puncture and see what happens? Okay, so I'm just making a small puncture over here to enter into the anterior chamber. So I'm using a blade to enter, and once I enter, did you see some fluid pouring out? See? Lot of fluid coming out. What is that fluid? It is the aqueous humor. What is the color of the aqueous humor? It is the transparent. Why is it not like blood, red in color? Vision. We want vision. We want clarity, isn't it? So it cannot be colorful. So I am trying to cut the cornea all around. What is the junction between the cornea and the sclera called? Limbus, isn't it? So what is the specialty of limbus? Is there some special cell over there? Stem cell. What is the function of the stem cell? What is the property of this stem cell? So they can proliferate multiple times. So each time one cell proliferates, it forms a daughter cell which replaces the cornea, and one cell remains there as a parent cell which is ready to proliferate any time. So it just goes on multiplying. So we got a better cornea compared to the previous. So dissecting a open eye, this eye is open, right? There is no intraocular pressure over there. What is the normal intraocular pressure? Yes. Now what is the intraocular pressure in this eye? It is 0. It is like atmospheric pressure. So it's very difficult to, can you hold the, it is very difficult to suture or even handle these tissues which are very, which are when the eye intraocular pressure is very low. So this structure, are you seeing what I am lifting now? Is the cornea. This structure is called the cornea. What is the thickness of the cornea? Can you see this? Can you see the structure here? Okay. Cornea, is it transparent? Yes. Right now there is lot of brownish fluid. Where is that brown fluid coming from? Where is the brown fluid? From the iris. Iris has got lot of pigment and it dissolves in the water, it disperses everywhere, and that's why it's appearing brown. But cornea is otherwise a very, very clear structure. What is the thickness of the cornea? Nobody told me. It is 0.5 millimeter thick in the center, 0.5 millimeter, and towards the periphery here, it is about 1 millimeter in thickness. It's very, very thin. Does it have blood vessels? No blood vessels. How does it survive? It's a living tissue. How does it survive without? Yes? Because of atmospheric oxygen, and glucose comes from the aqueous. So that's how it gets its nutrients. So now can you see that we have removed the cornea, and the space here was originally the anterior chamber of the eye, which was containing the aqueous humor. Now this is the iris. I'm lifting it. Can you see that? Yes? This is the iris all around, and the iris is attached to the ciliary body. Okay? So shall I remove the iris? Before removing the iris, I am putting this instrument behind the iris. What space is this? If this is anterior, yes, somebody said it, it is called posterior chamber. So between the cornea and the iris is the anterior chamber, and between the iris and the lens, this structure in the center is called lens, is called a posterior. What does the posterior chamber contain? Aqueous again. They are continuous through the pupillary area. So, can you see this? Now I am going to cut this structure and show you the lens. Shall I? Yes? Do you know any surgery done on the iris? Can you name some surgery done on the iris? Can you hold it? Iridotomy, iridectomy. These are all surgeries which are conducted on the iris. So I am removing the whole of the iris. Suppose normally or after some trauma, the whole iris is not there. It is all gone because it is separated from the ciliary body. It is called iridodialysis or irideremia. There are 2-3 conditions wherein the iris is lost. Okay, so this is all iris tissue. What are the muscles of the iris? Sphincter muscle and dilator. Which is responsible for reducing the size of the pupil? What is the nerve supply? Sympathetic or parasympathetic? Parasympathetic. And dilator muscle is supplied by sympathetic. So can you see some glistening structure behind here? Yes? Yes, what is that structure here? Can you see this? This is the lens. Okay, I'll use a bigger instrument. Okay. So it's very firmly adherent to some areas like the zonules, and that's why it's difficult to separate. In that eye, it was very easy to separate. In this eye, it's a little tough to separate, but this is the lens. Can you see the lens? Yes? And there's some brown tissue surrounding it. It is nothing but the ciliary processes. You want to check? Look at the structure. Now she'll nicely demonstrate how the magnification, this is a biconvex structure, correct? So it should cause magnification or minification of the tissue, of the object. Magnify. So she'll just show you how it magnifies. Can you see the letters increasing in the size? You put it, blade put it like this. Yeah. Can you read that? Is it clear? Yes. So is it magnifying? Yes. So it's a biconvex magnifying lens, isn't it? Biconvex lens. Because of that, it is magnifying in nature. See how it is roaming around. It's almost globular now. Okay, when zonules are there, it is more or less biconvex. But when zonular support is gone, it becomes more spherical in nature. Okay, so this is the lens. All of you saw this? Saw the lens? Okay. Now we'll see what is next here. This is the eye. Can you see this structure over here? What is this structure? Vitreous. See, vitreous has all come out. Can you see this is the previous vitreous? I don't know. Okay. Look at this vitreous. It is more gel form, whereas this is more fluid. Can you make out the difference? Okay, probably this is a younger goat and this is a little older goat. Okay, that's why it's become more liquefied, and this is called syneresis. Liquefaction of the vitreous is called syneresis. There are different kinds, synchiasis, scintillance, asteroids, hyalosis. The different opacities which can occur in this. So this is the vitreous in two different eyes which we have seen. Okay, then comes the rest of the eye. What do you think is there now inside this eye? Can you see something? Yes? What is there? Retina should be there. Let's see what is there. I don't think I can, yeah, we'll cut it. We'll try to cut that so that we can enter the eye and see the structures. Okay. So what is enucleation and what is evisceration? So I'm just everting it. There's some more vitreous over here. Yes. Can you see the blue, green, glistening structure over here? And I'm not sure whether you are seeing the blood vessels also here. Can you see? Can't I be? So these blood vessels are also there. And here is the optic nerve head. This is the retina. See, can you see the transparent structure called retina? These are the inner layers of the retina. These are the posterior layers of the retina. Can you see? These are the posterior layers of the retina. Glistening structure. And what is the brown structure behind it? Choroid. So this is the sclera. Outermost is sclera. Above that is the choroid. It's very, very thin layer, very delicate layer. And that's why in myopia, when the eyeball goes on increasing, the retina cannot increase so much. And that's why it gets tears, retinal tears and degeneration. So this is how the eyeball is. I hope you all learned. See, exactly here is the optic nerve. Just outside where we got the attached retina in the end. So this is the dissection of the eye. If you have any doubts, you can ask now. If there are no doubts, some of you who are interested can come forward and feel the tissues, because unless you feel the tissues, you may not be able to. This is the cornea, this is the lens. Handle very carefully. Only one glove per student so that everyone can use it. Use only one hand. Feel the retina here. Don't drop it. Take care. And before we end, we should thank the goat who has helped us to learn something today, isn't it? Can we have light here? Yeah. You can also feel the whole eye. Yeah, this is the whole eye. If you feel giddy or feel like falling, yeah? No. Hold it over the table. Yeah. There are more eyes. You can see the muscles, tissues. Oh yeah, that's the vitreous. Also the tears, okay, and some superficial conjunctiva. Can the whole eye be transplanted from a dead person to a new person, to a living person? No. What is transplanted? Only the cornea. You all see the cornea is also here? Yes. See, is it soft? Is it thin? Yes. The gloves should be removed carefully and throw it down. You need light. Magnification. Yes?